everyone, today we're going to talk about the African American population. So to start off with some characteristics, we have to first understand that they go through ethnic and racial identity development. So we looked at the cross model, which, just as a reminder, these steps include the pre-encounter, encounter, immersion step, and then internalization. Their family structure typically is non-traditional, where the mother is the head of the family, and in 44% of the households are led by married couples. Black children are up to 40% more likely to live with a single parent when you compare them to other racial groups. For spirituality and religion, this plays an important role. There's often a lot of church participation, and 3 out of 4 Black people report that religion is important to them, and a lot of their support systems are even connected through church. Some educational characteristics. A lot of times obstacles start at a young age with racism and discrimination in the school systems. Positive teacher and student relationships were a predictor for continued education after high school. There's typically higher consequences or harsher consequences for young Black children in schools, and they are 2 to 5 times more likely to be suspended. This is typically pretty discouraging because parents do try to encourage their kids to develop a career in education, but the school systems do not support them as much based on the behaviors that are shown. The youth is more likely to be victims of violence when compared to other groups. Young females experience sexism and racism at the same time. And yet they are raised to believe that they are strong and have to be more self-confident to push through these issues. Black women are the fastest group of incarcerated people. There's a lot of younger women starting to be incarcerated in prisons, and they are even more likely to be arrested for crimes related to things such as poverty, homelessness, maltreatment, things like that. And this discipline even reaches young girls with a zero tolerance in school for conflict, talking back, stuff like that. Some of the strengths that come along with this population is that they do have positive identity and racial pride. They have resources in coping, especially in terms of their social life. Their family structure is often different from a traditional American family. So they learn how to take on different family roles, and even extended family gets very involved and provides support. They also have very tight-knit community support. This is pretty common. They also strive for achievement orientation. They have a lot of spiritual beliefs and practices that help them out as a strength. And then they often instill beliefs into their children of self-esteem, and being able to be role flexible. For example, the term strong Black woman is an example of that. Next, I wanted to talk about an article that I found that talked about strengths for the Black community. So psychosocial well-being, higher racial centrality, and private regard were associated with racial identity, and this reflected Black pride and even investment in the Black culture. Feelings of closeness with other Black people in their community also was inversely related to depressive symptoms, so people who were more involved in their community showed lower rates of depression. Internalization and racial identity attitudes have been associated with increased self-esteem, psychological health, and inversely related to distress. Racial identity is associated with psychosocial health, and to understand these mechanisms, you do have to take into account racial socialization, according to this article, which is described as how the central internalized racial identity is transferred from person to person and from generation to generation. So it's really a community term and understanding. So some of the results of this study was that with the central internalized racial identity, this predicted Black cultural strength. So this is involving one's understanding of the race in their lives, and it affects the way that parents socialize their children and how the cultural values are passed on, such as the support for self-esteem and confidence in a young age. When looking at psychological and physical health and racism, Black people were considered better when compared to other groups. This is likely attributed to the strength that is instilled in them at a young age, which is most likely a result of the long-lasting discrimination that they have experienced throughout history. Possessing a high level of Black centrality and private regard is positive, yet it was not developed an ability to work with whites, and they can face distress in a number of settings. So this is typically better off when they are with other people of their community. And then empowering the individuals was the most effective coping mechanism of any race-related incidents. Some of the challenges that this group face, the first one listed here is that resumes with Black names get 50% less phone calls for interviews. So there's kind of the Jamal versus John argument of if you have a Black sounding name, then they're less likely to call you back for an interview. A lot of people in the white community believe that there's still equal opportunity for Black people, when this is just not true in many cases. Racial profiling with crime and harsher punishments. For example, there's a Black man who is killing a white man is 2 times more likely to receive a death sentence. So that is an example of a harsher punishment. Another example of this is with the Black Lives Matter movement. Police are typically more likely to seek out people of this population while on duty. Next is the deaths of unarmed Black men. Again, in the Black Lives Matter movement, this has been a big part of them fighting for different rights, is that innocent men are getting killed by the police. Another challenge is that youth with incarcerated parents are at a huge disadvantage. They have increased risk of poverty, failing in school, emotional distress, criminal activity, and drug use. So ignoring racial issues is another issue, and they get accused of acting white. And this can be a challenge because they're kind of stripping away their identity and accusing them of being a different race because that is not normalized for that community. Some challenges that were identified in research. So this is specifically about men. Homicide is a leading cause of death for males between the ages of 15 to 24. They also have lower graduation rates when compared to other groups. For example, even 10% of males 10% fewer of males graduated high school when compared to females of the same race even. They also have higher incarceration rates, which affects their future opportunities for employment. Cancer rates are also 20% higher in Black males compared to white men. There's also a higher risk for other health issues such as diabetes, heart attack, stroke, hypertension, etc. And then the onset of mental health due to discrimination, poverty, incarceration, substance use, homelessness. This is all a huge issue. This could be reflected by the bias against the community from mental health professionals. There's possible misdiagnoses, inadequate treatment given, and there's also limited access to mental health issues for the Black population. Another article talked about challenges for African American women. So mass incarcerations led to difficulty reintegrating themselves back into the community. One issue with that is oftentimes women who are incarcerated are already mothers, caregivers, or even the head of the house before they get incarcerated, so it is hard for them to get back into their normal daily lives after being in prison. Of these women, 50% of them report some kind of sexual or physical abuse while in prison. 60% of women admit to drug abuse in jail, and that can also lead to more difficulties integrating back into the community. They also have 64% higher HIV diagnoses when it comes to this population. Once people are let out of prison, there's no access to financial aid for individuals, especially if they show substance use history. So this is a huge issue for them because they are given less opportunities. And then, of course, they have discrimination against them when it comes to housing, employment opportunities. There's also not a lot of healthcare options for them. So lots of challenges that come up for African American women. So these two articles talked about the effects that COVID had on the African American community. So African Americans are dealing with a disproportionate burden of mortality during the pandemic, likely due to lack of access to healthcare, but there's possible other reasons as well. Systematic racism is a huge issue when it comes to mental health treatment for COVID, which affects African American families at pretty much any level. Black Americans experience higher COVID-19 hospitalizations, and their mortality rates are higher, as I said, and they have no access to health care, and this can also lead to mental health issues, which they're not receiving treatment for due to lack of access or financial ability to afford it. And in addition to this, African Americans have been shown to be more susceptible to diagnoses like PTSD and depression. And this was found in a study after looking at past horrific events that have happened in Black communities, such as hurricanes and other big events. And they were more likely to develop these two diagnoses. So how does all this apply to clinical practice? Well, it can help with a few things. So one thing that counselors have to do is to recognize that there is power and privilege and how this can affect their counseling, especially if they are of a different race than the African American community. Recognizing diversity within the Black culture, so knowing that maybe all the things that we talked about in this presentation or kind of stereotypes out there, not all of those apply to every single person who identifies as an African American. You know, they all have their own stories and experiences that make them different. Discussing how counseling can be useful if the person is mandated. This helps give them the opportunity to learn from it if they have to be there, and at least getting something out of it, because a lot of times this is not explained to them and they don't really participate fully or engage at a level that someone who is not mandated. Also assessing the person's strengths, figuring out what works well for them and what kinds of strengths they can use in their daily lives. And then helping clients define goals and ways to attain these goals is also important in clinical practice. So these are typically pretty standard practices in counseling, but making sure that you are doing it in a way that is culturally appropriate as well. Because they might have different values, preferences, worldviews, and it is important to keep all of that in mind when working with someone of a different culture. Also, to establish an equal relationship where the person that you are counseling feels equal to you and not like there is a power dynamic shift. Collaborating on determining interventions, so considering making culturally adaptive evidence-based practices as well. Determining how external factors relate to the problem, and how the client may respond to the racism and discrimination and how that relates to their treatment. Examining issues with racial identity, furthering that, you can consider the stage they're in with the cross model and with their racial identity. So next we'll talk about an article I found that talks about implications for clinical practice in addition to the textbook. So this article focused on closing the gap between the access and quality of the mental health services and the issues for this population that they have with getting good quality mental health services. So one of the ways they wanted to do this was to increase the number of psychiatrists and other mental health professionals. This gives it more variety and putting them in communities where African Americans live. In addition to that, increasing the involvement of appropriate trained non-specialist providers. And then increasing funding for services as well. There's often a lack of access, affordability for African Americans to get mental health services. So there needs to be more funding so that they can get those services. And then in another article, it suggested using strengths-based approaches when working with people of African American status. So using culturally adaptive evidence approaches like the strengths-based approach. Some of the recommendations for the COVID effects that it's had on the African American community include providing successful interventions that are race conscious and building upon the personal strengths and resiliency to help consumers manage their distress. Creating programs that work towards improving the mental health of African Americans, and making sure that they are culturally appropriate and competent enough in the community. Targeting effects of COVID-19 on mental health in that population, understanding their perspective and their experiences and how they might be different from the normal person in America. Providing integrated healthcare to those who are underinsured or just uninsured, because COVID has had a lot of financial burden to people's lives. And so whether they were uninsured before or after COVID, it obviously has an effect on people's financial status. And then early identification and intervention for post-traumatic stress, depression, or other psychiatric symptoms. As we talked about before, this population is more susceptible to developing those things after these big events, whether that's pandemic, hurricane, big natural disaster, or even more. So that's it for today. So that covers the African American population and talks about characteristics, strengths, challenges, and how we can implement that information into practice based on research and the textbook.